I'm going to demonstrate an IM injection. First, we're going to identify our 5 IM injection sites. So first we have deltoid, which is about 1 inch from the acromion process, is about right here. Then we have our ventrogluteal site, which we'll put our palm on the greater trochanter of the femur. We'll make a V with our fingers, and here we'll inject the medicine. Then we have our dorsogluteal, which you can find the greater trochanter in the prominence of the iliac crest, and we can draw an imaginary line here, and we'll put that one above the line. Or you can divide the butt into 4 quadrants, and you would do the upper outer quadrant. Then you have the vastus lateralis, which you will measure from the knee to the greater trochanter, and you give that in the middle. And then above the vastus lateralis, you have the rectus femoris. So that's the 5 IM injection sites. Our patient is ordered 7.5 milligrams of morphine. The scenario is she's had a hip replacement surgery. She has said her pain was a 10 on the pain scale. Doctor has ordered 7.5 milligrams of morphine, PRN. This is going to be her first dose of medicine, so the time and the medication dosage is safe. And we are going to check the doctor's orders. We're going to check for patient allergies. And then we'll come over here. We will perform hand hygiene. Then we will go and we will find our medicine. We will have morphine. It is going to be offered in 5 milligrams a milliliter. What we'll do is we'll check that. We'll come over here. We'll do our calculation. So it's going to be 7.5 milligrams over 1. And we'll do 5 milliliters for every milligram. Calculate that, 7.5 over 5. That'll come out to 1.5 milliliters. So that is the amount that we're going to give. And then we're going to check our medicine. We're going to check the expiration date. We'll check and make sure that the plastic cap and all that is on the medicine. We'll check, make sure there's no contaminants in the vial of medicine. And then we will check and verify the dose according to the medical administration record. We'll take a alcohol prep pad. We'll clean for 30 seconds in a circular motion. We'll let that dry. We'll get our syringe and our needle. We'll aspirate 1.5 milligrams of air, because that is our dosage. What we'll do then is we will uncap our needle. We'll be careful not to touch the plunger or the needle. Take this vial of medicine, we'll inject it in. Push the 1.5 mils of air. And we will draw up. One and a half milliliters of fluid. Make sure there's no air bubbles. If there is, we'll gently tap. So, given the correct dosage, get that air bubble out. And then we'll recap. Get our supplies ready. We'll need an alcohol prep pad, our syringe, our medication. And we'll need a Band-Aid or a cotton ball and some tape or something like that. Then we will verify our medication again according to the MAR, and then we will go to the patient. We will identify the patient with her armband, the name. We'll ask her to state her name and date of birth, and then we will check her allergies again, and we will perform hand hygiene, put on gloves. Then we will position the patient and take the alcohol prep pad and in a circular motion we'll clean the site for 30 seconds. Then we will let that dry. We'll verify our medication the third time, and before we give it, that is morphine, and that is 5 milligrams in 1 milliliter. We have 1.5 milliliters, so that's the correct dosage for the patient. Then we will take our cap off, and we will hold our syringe like we would our pencil. Make sure we don't touch the plunger or the needle, and go in at a 90-degree angle because this is an intramuscular injection. Do a dart-like motion. We'll aspirate. We'll hold the barrel of the needle and aspirate to make sure there's no blood. There's no blood, so we give the injection. Remove the needle. We'll throw this in the sharps container. We'll not recap it. Then we'll take our alcohol prep pad and we'll put it on the side of the injection and hold firm pressure or either massage. And then we will position the patient back to comfort, and we will take off our gloves and perform hand hygiene. We will make sure that we'll make sure that we document correctly and that we have initialed the time and date of our medication, and then we will check on the patient in 30 minutes, see how the medicine is working.